The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
The body temperature rises, followed by a hot flash. Night sweats start disrupting sleep and causing irritability. It's the end of one phase for a woman and the beginning of a new one.
I feel better than I ever have in my life.
It's a change in life that happens to all women, yet affects each woman differently. On today's program, we'll explore the complexities of menopause, the different stages, the available relief treatments, and the serious threat of osteoporosis. Stay tuned for this special edition on understanding menopause, next on Today's Health. This program is brought to you by an educational grant from Eli Lilly.
We all face certain passages in life, and as our bodies change, so do the challenges to our health. Hello everyone, I'm Faith Daniels, and this is Today's Health. For women, a key passage in life is menopause. This transition actually happens over several years, and the experience is different for every woman who goes through it.
It seems as though every time my friends and I get together, we have some basic subjects we always cover, and it always comes up. We talk about menopause and who's going through hot flashes, who's not, what kind of therapy they're on right now.
I don't think I expected to experience mood swings and hot flashes in my 30s.
I'm experiencing some changes within my body that I don't understand. I'm not normally this way.
I really went through it as long as I could, until literally I was awake every hour on the hour, and I had to come to the doctor to get something because you just kind of have to get through it.
Menopause, the change of life. It's the end of one phase for women and the beginning of a new phase. It's a natural event that happens to all women, yet affects each woman uniquely. And because every woman's menopause experience is different, there are no simple answers on how it will affect your life or your health.
First 3 years were pretty rocky. It was pretty rough getting through it.
It just came at its own time. So there was that feeling of helplessness, that you needed to get control of your life again. What can I do to make my life more even keel?
Menopause is actually a definition of a term where the menses or menstrual cycle ceases, and therefore menopause, pause of the menstrual cycle, which means basically that the woman's periods have now stopped, which also means that she's no longer producing eggs and that her production of hormones, estrogen and progesterone and other hormones that come from the ovary, have decreased to a level below the physiological impact it has on the body.
Menopause is not a sudden event. It's a progressive event that can take many years. Some women may start to suffer the symptoms at age 30 or 35. Most people will start to have some effects in their mid-40s. Those effects can range from irregularities of their periods to emotional changes, irritability, depression, breast tenderness, cramping, and similar symptoms.
The years leading up to menopause are called perimenopause and can bring about changes in a woman's body that may be confusing and even difficult to cope with. Fortunately, though, we now have information about this transitionary time, and understanding the changes can be the key to coping with them.
It is a transition. Your body is taking you on a roller coaster ride. And no matter how level-headed, no matter how all-together you are, if your body is causing changes and if you are sensitive to them, because there's some women, like I said, 10-15% have no symptoms, they just feel great, they go on with life, but the great majority, to different degrees, will feel different changes.
I didn't know when the hot flashes were going to occur. I didn't know when I would feel depressed or have a lack of energy. I really felt out of control.
I don't think that there's too much I've been able to do to avoid the hot flashes. When they happen, and it's not selective. You could be in your bathing suit in the ocean and have a hot flash. It just happens.
You have the feeling of warmth
that starts in your head, permeates the face, neck, chest. Some people actually have sweats along with these hot flashes. The flush is usually some change in skin color. Sometimes you see a reddening of the skin. And these can be very debilitating for some women.
Night sweats can disrupt sleep and lead to tiredness and irritability. Again, like all changes associated with menopause, night sweats or hot flashes are different for every woman. While as many as 2/3 of all women experience hot flashes, some effects are easy to ignore, while others can be annoying, even debilitating.
I could be walking down the stairs to go to work, feeling fine, and I would want to cry, and I would start, just uncontrollably start crying. And other times, you know, I would wake up in the night with these night sweats and just so hot I couldn't get cool.
Up until just a few months before it had started, I was regular as clockwork. And then I started getting like scattered periods for about 3 or 4 months. At the same time, the hot flashes were starting up.
Any kind of abnormal bleeding in a woman is some concern. It can be menopause, it can be hormonal. However, it could also be beginnings of cancer, uterine cancer. It could be polyps or little growths in the uterus. It could be fibroid tumors, which are very common. It could be infection of the lining of the uterus. It can come from any number of sources. So the assumption that it's menopause is not the first thing we think of, depending on the age. That's probably one of the last things we think of. We first rule out the other problems. If everything else is ruled out, then we can measure hormone levels in the blood and determine how to best treat that person.
The signs of abnormal uterine bleeding is when, for that particular patient or woman, there is changes in flow, in frequency, or in timing. And one of the things that could cause that, and what happens in perimenopause, happens in some of the medical conditions I was speaking about, or in menopause, is that you don't always ovulate. So when you don't always ovulate, you can have changes in your hormonal pattern. So it's actually a very complicated cycle.
Is there relief from the effects of menopause?
In terms of non-prescription remedies, these are things that a woman can actually go to the store and get herself or try to improve in her diet.
But the most widely studied medical strategy is ERT, estrogen replacement therapy. Next, on Today's Health.
Today, women want to know more and have better communication with their healthcare provider. With over 500,000 women entering midlife each year for the next decade, the interest increases every day. This generation will also live longer than any other, with 80 years now being the average life expectancy for women born in the 1950s. Women will spend approximately 30 years in postmenopause.
Perimenopause is an excellent time to do an overall health evaluation. Your body is changing and you want to actively plan for the next 40 to 50 years of your life.
The impact of lack of hormone is significant. There's an increase in hardening of the arteries throughout the body, where estrogen we know has a protective effect, but once the estrogen levels drop, that protective effect is gone and women suddenly develop as much heart disease as men. There's an effect on the bones. No matter how much calcium you consume, it's not going to help because the estrogen actually carries the hormone. Estrogen will carry calcium from the blood into the bone.
When we look at bone loss and bone formation, it's kind of a balance. And unfortunately, as we get older, we tend to get more bone that's actually resorbed or lost than is formed or laid down.
It's been clearly shown through many years of research that a lack of estrogen leads to osteoporosis in a very large percentage of cases.
Osteoporosis was a big thought in my mind because both of my parents had had it.
Estrogen replacement therapy, or ERT, is one of the central decisions that women face during menopause. It is a medical strategy to address the short-term and long-term effects caused by lower levels of estrogen. Available in customized doses, ERT can be taken as oral tablets, skin patches, vaginal products, or injections.
There are a number of benefits of estrogen replacement therapy. One of the main ones is that it prevents heart disease or reduces the risk of heart disease. They have found that if you take estrogen replacement therapy, it reduces your risk of having your first cardiac occurrence by 50%. If you've had already a heart attack or any kind of vascular coronary artery disease, it reduces future events by 80%. And the survival is also very high, so that is one of the biggest benefits that actually we can measure. Another one is osteoporosis, in preventing it and in treating it as well.
Another consideration is Alzheimer's disease. More women get Alzheimer's disease than men. And what we're finding is the women who take hormone replacement, it seems to have reduced Alzheimer's by almost 50%. That's significant.
I've read a lot of books and magazines, and they spell out very clearly the risks of taking replacement therapy. And I feel that the benefits outweigh the risks.
The risks of hormone replacement treatment are few. Most people will have some side effects, perhaps some spotting, breast tenderness, and the like. Long-term effects that are of concern to us are breast cancer, and that is still under investigation.
There is an increased risk of breast cancer. However, it's only with long-term use of hormone replacement therapy, and that has been borne out by the studies. However, if you do look and analyze those studies, it's really small numbers that you're talking about. However, if you're the patient who should happen to get breast cancer and you're on hormone replacement therapy, then it does become a big deal for you, and I think in that light, then we need to counsel our patients appropriately.
If you had to weigh the benefits versus the risks, which we do in medicine all the time, the benefits of hormone replacement therapy is way up and the risks are way down. And that's a pretty good ratio for making a determination. And my recommendation to those women is take the hormones and take them as long as you can, because you're going to live longer, and you're going to look better, and you're going to feel healthier than those women who don't.
There was no family history of mine for breast cancer or any type of cancer, so I felt very safe going on hormone replacement.
My mother and father both had high blood pressure. My mother had diabetes. I had an aunt die of breast cancer. Both of my parents have passed away recently from cancer. So I did think about all the health risks, but I was not used to feeling the way I did, and I needed to have something to help me get over this. And so after a lot of thought, I decided to start in the replacement therapy. I think it's the best thing I ever did.
Today we have the benefit of new research and new treatments for both the short and the long-term effects of menopause. From lifestyle changes to more targeted therapies, women have a wide range of choices for maintaining health and well-being as they age.
There's been a tremendous amount of research performed over the last 50 years on menopause. Perhaps the first drug that was widely used was Premarin, which was introduced around 50 years ago. And for many, many years, that was the only treatment available to help with the symptoms of menopause. Since then, a lot of research has developed. We've learned a tremendous amount about hormone replacement treatments, and there's a vast array of medications available now.
The designer estrogens, as they're called, are really something that we call SERMs, or selective estrogen receptor modulators. And there is one on the market now, raloxifene. Essentially, what it is designed to do is to give you some of the good effects of estrogen, but try to cut down some of the side effects of estrogen, particularly at the level of the uterus.
These are medications which act like estrogen on the bone and in a few other parts of the body, but then act like an anti-estrogen in the breast and in the uterus, which actually may prevent certain problems, such as cancers of the breast and uterus.
And the studies that they have to date do, in fact, seem to show a decreased risk for osteoporosis. Unfortunately, they don't have as much impact in terms of the vasomotor symptoms that a woman may have, and can actually increase her symptoms.
There's no magic pill that makes it go away. There isn't. I haven't found any magic pill that makes you feel better.
Coming up.
Estrogen alone will not do it, neither will SERMs or any other drug. The key, of course, is good, healthy living.
Although menopause is a time of physical and emotional change, there are lifestyle modifications women can make to help maintain good health as they age. Next on Today's Health.
Today, many women are exploring drugstores and health food stores to find relief from menopause changes. These range from vitamins to plant estrogens. Oral doses of vitamin E are used for hot flashes. B-complex vitamins are sometimes used by women to help relieve dry skin and dry hair.
I have many women who come in and say, I feel great, I exercise, I eat good, I eat vitamins, I'm a vegetarian. I feel good, and I don't need to take any hormone replacement. And to some extent, that's true for a while.
I take a multivitamin and some herbs and minerals every day. And I also make sure that I eat as little red meat as possible, mostly chicken or fish, salads, things like that.
In terms of non-prescription remedies, these are things that a woman can actually go to the store and get herself or try to improve in her diet. Such things as phytoestrogens, which are estrogens that occur in certain plant foods such as yams, also soy products, soy milk, soybeans, tofu. Most recommendations are 3 to 4 servings of those a day. There are some early abstracts that do seem to show that it will certainly decrease a woman's vasomotor symptoms such as the hot flashes and the night sweats.
Estrogen alone will not do it, neither will SERMs or any other drug. The key, of course, is good, healthy living.
Lifestyle plays a critical role in both men's and women's health. And certainly the most dangerous lifestyle habit affecting health today is cigarette smoking. It is the greatest preventable cause of illness and premature death in this country.
Tobacco has been shown again to be one of the most damaging habits that we could have. In fact, if there was one habit that you could stop in order to improve your general health, that would probably be it.
The smoking causes heart disease, it causes cancer of the lung, the pancreas, probably some ovarian cancer and cervical cancers tied into smoking, not to mention a host of other cardiovascular conditions it causes.
There's an increased risk of osteoporosis in women who smoke. There's even earlier menopause in women who do smoke, and we do know that women will go through the menopause at least 1 to 2 years earlier than they would have if they smoke.
Adequate exercise is also essential for health. Walking, running, aerobics, and weightlifting will help the heart, bones, and muscles and can decrease hot flashes.
Be it aerobics or walking 3 to 4 times a week for 45 minutes a day where you would raise your heart level, swimming, anything that you like, but exercise is extremely important. It not only helps your heart in terms of keeping your heart healthy, but it definitely will also help to decrease the risk for osteoporosis if you're doing weight-bearing exercise.
I lift weights 3 days a week, and I either do aerobics or yoga, a spinning class or walking, some sort of physical exercise every day.
Managing your weight and lowering your stress levels through exercise, meditation, and yoga can mean not only a longer life, but a healthier one too.
The yoga I do for peace of mind, for the stretching, for relief from stress from my work. It certainly calms me and centers me.
Menopause, like puberty, is a time of strong physical and emotional change. While our attitudes have changed toward what generations have called the change of life, many traditions still influence our thinking.
Certainly menopause is not a disease state, and some people have looked at it like that. I try to get them to look at this as a natural part of life, and as you go upon this natural path of life, let's do some things now that can help to maintain that naturalness of life.
I think in medicine we tend to consider some of these natural events illnesses, but they really aren't. They're just a natural progression.
It's not something to be afraid of. I think it's a time for a woman to enjoy herself, enjoy life. In fact, I think it's a good time for a woman.
I recommend to all women, even in their 30s, that they start reading, that they start questioning and speaking to other women, that they start educating themselves so that they can understand even what they are feeling. And if you don't feel your answers are getting answered, if you don't feel that you are getting the attention that you deserve and you need, then you should not stop until you do.
When we see women in menopause, the other thing we as physicians have to do is look at their lifestyle and basically tell them what they need to live long and to live long and healthy. And today we have a unique opportunity to do that.
Certainly we know that women are living longer and that there are good years ahead of them. And I think that if we counsel women at that time, then they don't have to look at the menopause years as a negative time in their life. Unfortunately, society tends to look at that time in a woman's life as a bad time in her life because of symptoms she may have or problems, but we as healthcare providers can put a more positive light on that.
I've had my children, I've been mommy, and seen them through their growing up years, and now they're on their own. And the change of life for me did not mean something negative. It's a positive experience, and this is the second half of my life. And I really feel, although the first half was very rich in experience, this can be just as enriching.
Today, we have the benefit of new research and new treatments for the short and long-term effects of menopause. From lifestyle changes to more targeted therapies, women have a wide range of choices for maintaining health and well-being as they age. If you would like more information on menopause, you may contact the North American Menopause Society, known as NAMS. This nonprofit scientific organization is devoted to providing accurate, unbiased information for women and their healthcare providers.
You'll be amazed at how much information there is on the internet concerning your health and well-being. For a good start, visit our Today's Health website at vstar.com. Some transitions pose more difficult challenges than others. Understanding what is happening to your body and taking steps to cope can help you maximize the positives and minimize the negatives as you go through life's changes. I'm Faith Daniels. Join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.